assistant professor in Global Hospital. I'll be showing something new you've never seen in your life. It's called virtual reality in radiology. What is virtual reality? What is it going to do? If you talk about computers in 40 years back, if anyone says that computer will be ruling, no one would have been believed that, but computer is ruling. Same way I am telling now, virtual reality will be ruling the world within 20 years. What do you need here? What is going to happen? Just imagine if you want to go to any zoo or any factory, there is no need to go there. You can take on VR glass and then you will be positioned there. You will feel that you are staying in the place. Just example, just realize that if you want to go to New York, Times Square, and we are living on glass, and then you feel that you are in New York, and you can feel that you are in zoo directly. Just see that if you want to see the cricket match, we will be giving glass so that you will be sitting in the stadium virtually. What you need? You need headsets like a VR glass. You can see that, and then there will be input device. It is called handheld device, and you need one high-end computer. What is the purpose of VR? You can say that it can be used for entertainment or educational and training, but it is going to come in medicine shortly, so that even it can replace all our monitors. It is a revolution in medicine, and you can use it for training as well as treatment as well as diagnostic purpose also. What will be the impact? So training will be very easy. Like there no need to take, for example, if a doctor wants to see the surgery, no need to go to the operation theatre at all. If you are giving the VR glass, you can see virtually the procedure lively. And for example, if MRI is there, one patient is feeling phobia, claustrophobia, if I put glass and then he can feel that he is in the MRI room. So we can train the patient for a few minutes and then you can send the patient to MRI. You will not feel any fear about MRI. So this is a definition that you will be placed in a new environment so that you can see the real feeling. This is what going to happen. See that one guy is having the VR glass and he is seeing the whole anatomy with blood vessels in big way. Just imagine if I am standing here, I am wearing the glass, so I can see whole abdomen here with blood vessel, everything. This is what going to happen. Can you see that the two people are seeing the 3D images and then really they can cut it and then they can see through that. So let us experience what is VR. So you will be given a glass like this and you will be given two controllers. He is a surgeon, now he is seeing the actual MR image in VR glasses. You just see that what is the difference between the ordinary monitor and what is the VR. See that he is handling that. See, you can see the whole image in the room as a big shadow like that. This level, he can pull the skull towards him and then he can cut it and then he can see any angle. What is the advantage when you are seeing through the VR and when you are seeing through the monitor? I'll show you. He is actually seeing the all planes. As a surgeon, just imagine that when a surgeon used to he wants to do one surgery, what he has to do is he has to put the patient on supine position and he has to approach from the skull. Now he is seeing the actual image. You put the patient on the supine position and he is seeing the image so that he can easily plan for his surgery. That is more important. So what is the advantage is when he is placing the patient on the table and there is no surprise. He is placing the patient as same as in surgical table and he is going through the bone and seeing the lesion. This is giving very comfortable position for the doctor so that he can simulate the procedure and it will be easier for him to do the surgery. Now we are coming to the intervention radiology. You know, usually intervention radiology, we used to put the stent in the aorta. Here, one doctor is planning the stenting procedure in aorta. Yes. Now what he can do is, he can pull the whole aorta from distance way and then he can keep it near to that and then he can draw the stent and then he can measure actually what is the length, what is the diameter, everything he can measure. Finally he can place the stent very precisely. What is the advantage here? But everyone is having CT images, everyone is having MRI images, you can see the length, the diameter, everything. But here we are simulating the actual body real time and then you can plan properly so that you can minimize the radiation exposure during the angiogram. This is the main advantage. Finally, what will be the benefit to the patient is precise placing and finally not much complication. Not only in radiology, it can be used in cardiovascular and neurology and even musculoskeletal also. Thanks for your patience. I hope we will be rolling shortly.